Pharmac is proposing easier access to asthma inhalers, which, if approved, would exhaust the record $600 million investment into new medicines that was announced last year. And there are already calls for the government to stump up more. Blood cancer patients weren't covered by the record funding, and 3 News can reveal nearly every haematologist in the country has signed a letter urging the government to fund blood cancer medicines in this year's budget. Here's senior political correspondent Jenna Lynch.
Haematologist Roger Tiedemann has seen too many patients he can't adequately help. Not because he doesn't want to, because the government hasn't provided funding.
I mean, it's terribly depressing as a physician to sit with patients and their families and explain that there are easy treatments that could be given that would turn their lives around, would give them many more years, would improve their quality of life, but the government has chosen not to provide those to Kiwis.
In March, he and nearly every haematologist in the country wrote to the Prime Minister, his deputy, the Finance Minister and the Health Ministers, pleading with them to commit more funding to blood cancer medicines.
Unlike patients with solid tumours, they can't undergo surgery or respond to radiation treatment. Their treatment is entirely dependent upon medicines, and when the government doesn't fund those medicines, they're simply forgetting those blood cancer patients.
Last year, the government was pressured to fulfil its commitment to fund 13 cancer drugs promised by National on the election campaign. It borrowed $600 million from this year's budget to do so, having to fund other drugs ahead of those 13 on Pharmac's waitlist as well, to ensure the drug buying agency's independence. No blood cancer medicines were among the 13 promised, as the Cancer Control Agency was yet to produce a report outlining what medicines New Zealand needed at the time National made the promise.
So again, we're sending out a signal to the people with myeloma and the people with leukemia. We understand, we haven't forgotten you, we just need that piece of work to be done by the Cancer Control Agency.
That report came out in October and found 12 blood cancer treatments that are funded in Australia that would have significant clinical benefit to New Zealanders if funded here.
The former Minister of Health, Shane Reti, said, "Blood cancers, we have not forgotten you." So people with blood cancer interpreted that as a promise, and that's a promise that this government have to deliver on.
We asked the Health Minister whether he planned to keep the promise.
What we've committed to is what we provided last year's budget was $600 million more over 4 years.
But that's pretty much run dry, and only about 180 patients out of the 21,000 with blood cancer benefited from drugs funded out of that $600 million boost. Judging by the Minister's language, the government isn't planning a top-up.
Has the National Party broken its promise to blood cancer patients?
It really has. It's forgotten them.
Tiedemann met with Health Minister Simeon Brown a couple of weeks ago to try again to impress the importance.
I think he made a show of listening. I think he took notes, but he made no commitments to change anything.
Patient advocate Malcolm Mulholland is warning the government it will have to look patients in the eye as it delivers its budget on May 22.
As we've done year on year, we will be coming in the gallery and listening to the budget being read, and I will have with me blood cancer patients who will be seeing whether they live, whether they die, or whether or not they have to sell their house or shift to Australia.
While Roger Tiedemann has a simple message.
Wake up, Prime Minister. New Zealanders are dying and suffering.
Suffering while hoping the government lives up to its word.